the dentistry field, they just nailed it. You got the check-ins, and they also got the 2 times a day brushing your teeth. Like that's nailed into everyone now. Like movement snacks throughout the day, you know, even if it's not like a full-on workout, like doing something for your body twice a day, and then going to get a checkup from a professional that can help you really fine-tune some things and make sure you're feeling good.
Welcome back, JT.
Good to be back,
hey,
man.
We're here. This is super fun because this is the last episode of our first season, which is really fun. This is a finale. And so we thought we wanted to do something kind of special or a little bit different on this episode compared to what we've done before, which is get some Q&A going from the audience. Yeah. So maybe at some point we can actually have like a live call in. I think that would be kind of cool.
Yeah.
Have people call in, but
there's some risk there. But
I don't think
risk it to get the biscuit.
I don't think we have a big enough following to actually get people on the line yet.
People that are watching.
So, but we did have some people submit some questions, which is really fun.
Yeah.
So thanks everybody who submitted questions, and excited to dive into those. And we're going to kind of like rapid fire through them and pick some of our favorite questions that we got from the audience, and then go and just see where the conversation takes us from there.
Let's do it, man.
Ready to roll? Okay, first one is... What was the first one we were going to start with?
I'm so excited. I was confident. I was like,
first one is... Oh, that's what it was. The first one is PTs and chiros.
Yeah.
How can a PT and a chiropractor, mortal enemies of the universe, come together to both best treat and help athletes?
That's a great question.
And let's define athlete by anyone who moves and breathes.
Yeah.
Right? Anyone who moves and breathes is an athlete.
Yeah. You walked to the mailbox this morning?
Boom.
Athlete. Yeah.
Mailbox athlete.
Well, yeah. Mailbox.
There we go.
Yeah, that's a great question. I love that one. Yeah, I would say, you know, on the physical therapy side, if a patient has something that is more spinal related, like when I think of chiropractors, because I used to see a chiropractor when I was in high school, and it was very helpful. Acute neck injury that needed some attention. Like, I know that, yes, I know the spine. I know how to do some soft tissue mobilization around it. I'm not as comfortable doing adjustments. I've gotten some training on it, and I can, but I know that there is someone that they're much better qualified than me to do that. So when I'm thinking of like bringing in a chiropractor, like if I'm trying to refer to a chiropractor like yourself, like I would text you about, hey, I have this patient that has XYZ, things going on. I'd love for you to take a look at him and see if you think an adjustment might be necessary, or if there's something like within your field that you think might also benefit him. So as a physical therapist, that's what I would be looking for in terms of how we could work together. Things that you do really, really well that I'm not as trained in, that I would want you to help with this patient, because I'm a big believer in the team care. I think that's when a patient gets the best benefit. But the asterisk there is that the team needs to be communicating about the patient and not giving different conflicting opinions on things, because that can do more harm than good. And that has happened before, and it is brutal to work with as a therapist, to try to break down other, things that other people have said that have confused this patient that might have been different from what I said. Yeah. And then they're like, well, he said this and you said that, and now I don't know. And I'm like, here we go. So whoever I'm working, chiropractor, surgeon, whatever, before anything like that, communication has to be solid about, this is the patient case. This is what I think. I'd love to see what your thoughts are on it. And I'd love to call you after to have this conversation before we maybe continue with treatment and talk about the patient. Yeah. That's kind of a general thought of how I look at it.
For sure. Yeah. I think as an initial reaction, my main thing has always been, if both parties are doing what's best for the patient, then there shouldn't really be much difference between the two anyway.
Correct.
And so, as far as like an adjustment goes, there are certain cases where getting adjusted is really, really helpful. Like if you have a really a really like guarded and locked cervical facet syndrome. You know, like a cervical adjustment goes really, really well to help free that up. Like you can do like a grade 4 mobilization, right? Or, you know, like a lighter mobilization than like an actual adjustment, right? But I guess that's that grade 4, grade 3.
What?
An adjustment, it's grade 4.
5.
Adjustment's grade
and
5.
And PT school is grade 5. Yeah.
PT. Okay.
Yeah.
So yeah, so you could do like grade 4 mobs, right? You know, and be able to like get some of that benefit, but it also is just like way faster just to like adjust it, you know? So you could sit there and try to mobilize it for 5 minutes, or you can just adjust it and you get the same result.
Yeah.
So it is a great tool because you get good results from improving motion quickly, right?
Yes.
But not everybody's a candidate for that, right? Like some people have neck pain and they actually don't have restricted cervical range of motion. So their neck pain is not coming from the fact that their joints aren't moving well. So we don't need to adjust them. And in fact, adjusting them could cause more harm than good, right? So there are certain situations where this specific skill of adjusting as far as a chiropractor goes is helpful and beneficial. And then there's other times where that adjustment skill is there's other things that are going to be better for that person, right? Either way, whether you're a physical therapist doing mobilizations or a chiropractor doing adjustments, like if that's the only tool that you have in your toolbox, then like you'll get some people better, but you're just going to miss the boat on a whole lot of other people, right? And so I think it comes down to if the only tool that you have is a hammer, then everything that you see is going to be a nail, right? And so our goal is always to have multiple tools in the toolbox so that we can do the right intervention for the right patient at the right time and, you know, get better results that way. So I think in terms of like PTs and chiros working together, to me, the way I view it is that you should be able to, if they're good, you should be able to see a physical therapist doing their job, a chiropractor doing their job, and looking at them, you wouldn't be able to tell the difference who is who. Yeah. That's my personal opinion. Yeah. You know? So as far as like working together, like I just don't see, you know, the skill set being like all that different if you have somebody who knows their stuff. Yeah. You know? Truly. But at the same time, like you can have some, you know, bad chiropractors that don't really know what they're doing. Like they are just trained to adjust and that's the only thing they do. And like, you don't want to go see them for your rehab, you know, for like higher complexity issues. You just want to see them for some maintenance stuff. Sure. And then same thing, you could have a physical therapist who's like literally only worked with geriatric patients and has no idea how to work with higher performing athletes. Yeah. And you probably don't want to go see them either. Right. So you know, it's a give and take. It's just like any other profession, you know, if you got good and bad. That's it. And on both sides. Yeah. Yeah. You know, so, but it is something that it is a question that I get a lot though. You know, it's like people will ask me like, oh, well, what do you think about physical therapy? And then it's kind of like we were talking about before, like, what about massage? And I'm like, what do you mean what I think about it? Like, it's great. Yeah. Like, what do you think I do all day? You know? So physical therapy is interesting as a word, right? Because it's a modality and it is also the name of a profession. Right. So like a physical therapy is a profession, but physical therapists do the act of physical therapy, which is also a treatment intervention. Oh, you're twisting my brain a little bit. I didn't think about. Do you see what I'm saying? Yeah. Like versus like if you take a chiropractor at like, let's just talk about like a traditional chiropractor, right? A chiropractor does adjustments. So the intervention that they do versus the name is different. But like at the baseline, a physical therapist does physical therapy. Oh, so it's the name of a profession and it's the name of a treatment intervention at the same time. We call it manual therapy. So it's like that, I guess that's what exercise therapy wouldn't be manual therapy, right? No. Yeah. Okay. So I'm just talking like I would consider exercise to be a modality as well. Right. It's like it's a mechanism of treating somebody. Okay. Right? Gotcha. So I think the confusion sometimes comes in to be like, you're a physical therapist who does physical therapy. And then I'm like, I'm a chiropractor and I do physical therapy. Oh. Do you see what I'm saying? Oh, yeah. Do you see what I'm saying? I'm seeing now. But what's tricky, though, is that like we actually might have to bleep that out because in Tennessee, chiropractors are not legally allowed to say they do physical therapy. Oh. It's kind of crazy. Dang, I did not know that. Yeah. It's kind of crazy. I didn't know. So, old turf wars. So I can do like physical rehab. I can do rehab therapy. sports therapy. I can do like any other combination of the words.
Not mine, buddy.
Yeah.
That's mine. Okay.
Yeah. It's like, all right,
Sick, dude. There you go.
Here, you can have it.
Yeah. Oh man. That's
Yeah,
good.
but it does get confusing for people.
It does, yeah,
right?
and you can see why there has been, unfortunately, some back and forth there battles. Like, and at the end of the day, man, like we're all just trying to help people, man. Like, that's
dude.
what I'm always. So
Yeah.
I
It
got
is
you.
pretty silly.
Yeah,
You know?
we live in a silly world, my friend.
Yeah,
so
we
we're
do.
Just, we're
There's
just
a
trying
lot
to
of
have some fun
silliness
with it.
out
You gotta
there.
laugh. You truly do
You know?
just have to laugh at it, man. Like it is what it is.
Yeah.
Have some fun.
Yeah, man. It's just, it is tough, right? And I'm sure you see this in some ways too in your profession, but I mean, I feel like I just devote, and I've had to try to step away from it a little bit, but I just feel like I devote so much of my professional energy to like having people know that I'm a chiropractor, but like I'm not a chiropractor. You know what I mean?
Yeah, there's been just bad rap about him because of some of the, again, social media stories and all those things, which is unfortunate on your end.
Yeah.
I know that has to suck.
I mean, there's a lot of whack ones out there. I mean, it's crazy. Like, there's some people just spewing some wacky ass bullshit. That's for sure.
Yeah. That's partly why we wanted to start this podcast, was to kind of break some of those things down and show that, it's it's not all like that, man.
Yeah,
So,
it's crazy, dude. It's crazy. So we do what we can,
You're
helping
killing
one
it,
person
dude.
at a time.
You're killing it, man.
Yeah.
That's all good.
I guess along those lines, another good question that we had that came in was, for longevity purposes, how important is it, in your mind as a physical therapist, how important is it for somebody to get established with you even before they get injured or before they have pain?
I love that. That's a good one. And honestly, as a physical therapist, I'm going to be a little biased in my answer, but I do strongly believe that I think that having someone that you trust that knows your body well is one of the most amazing gifts you can give yourself. And you might not realize it until you have it. So I'm big on proactive treatment versus reactive treatment. There's a movement that's happening in the medical field that I love to see, is getting ahead of these injuries, because one of my favorite all-time phrases that I tell patients all the time is that the best way to treat an injury is to prevent that injury from ever happening. And that can come from having a check-in with a patient, with a physical therapist, a chiropractor, somebody that knows your body well, when you're not hurting. That's when we are I think that's when we can be the most vulnerable to an injury, when we're not, because we can take things for granted. We might be doing something wrong without even knowing that we're doing it wrong. When I say that, I mean, looking at your load management throughout the week. Are you doing way too much, or is your form off on this one particular exercise, or several exercises that over time might load a certain tissue a little bit too much that could potentially put you at risk for an overuse injury that takes just a quick fix and it's like, oh, we got it, I feel better. And then any sort of like aches and pains that naturally come up with living a very active lifestyle, especially if you're training for high rocks and marathon. Things pop up, and it's the sooner you treat something, the sooner you can treat something, typically the sooner it goes away. It's not always the case, but that's a general rule of thumb. When something pops up, you want to treat that. And when you have someone that you're established with, that knows your body, that knows your history, that knows your goals, knows your personality, you know what I'm saying? Like, it just makes it so much easier. So to answer the question, I do think it's important to have, and I know you have a good point about this, like an analogy that you have with another profession that I think is great. So kind of your talk on,
I mean, we were
that.
talking about it before, that I think that the industry that's done this very, very well is dentistry.
Yeah.
And how, in the dental world, it is considered standard that you go get a checkup every 6 months, and you go do that whether you have a cavity or not, because it is to prevent you from having to do a more serious procedure for your dental health later on, right? So early intervention, right? So it's early detection, early intervention. So we're able to identify something as a cavity, and maybe you just need to get a filling as opposed to having to get a full-blown like root canal, right? And so kind of a similar thing to me, we think about like, now oral health is very important, right? So this is not to like say that this is more important than that, but like your mouth is this big, the rest of your body is a lot bigger than that.
Yeah.
Right?
Yeah.
And there's a lot more moving parts going on than just your teeth and your tongue and, your gums and that kind of stuff. You've got every single muscle, tendon, bone, joint, and nerve in your body that is being utilized on a daily basis. And you are ideally exercising and putting them all through stress and strain. And so if you're going to treat your mouth with that kind of like proactive health type of approach, it would also make sense to me that you do the same thing with like your spine and your shoulders and your hips and just like how your movement is in general, right? And so that we think about your movement and your exercise health is something that I really want to see culturally we get a shift in. That like, are you getting... It's not just enough to just be like, hey, I'm just going to go work out every single day, right? But it's, are you actually getting the, are you making steps forward and progress in the right directions with your movement and exercise? Are you getting those like movement checkups throughout the year to make sure that like, hey, you're not like all of a sudden losing dramatic shoulder rotation in some way, It's like I had somebody come in who just like for the first time had never had shoulder issues. For the first time came in, his shoulder was like killing him after bench press. And I went and looked at it, and he was like, he had a massive loss in shoulder internal rotation and crossbody adduction, right? And for those who are watching who don't know what that means, essentially the two very important ranges of motion in the shoulder for a bench press, he had lost on that side, right? And we cleaned it up, and we were able to clean it up in a visit, and he was feeling way, way better. But we were able to do that in just one visit because he got in early and he was able to say like, hey, this is feeling kind of weird. I want to get it checked out. Boom, we were able to take care of it, right? Now, had we had done something that was probably a sooner checkup than that, then probably we would have seen that and caught it before it actually became an issue. And so that's just like a small example of how, what I really hope that we start to see change in the world is that people who do value movement and value exercise and want that to be part of their life, that they understand that, there is a trade-off here. There's a risk reward with exercise that I think both of us would agree the reward far outweighs the risk, right? We've talked about that ad nauseum, but at the same time, we should probably be doing certain things, and there are certain things that we can try to become aware of and we can look for to try to mitigate those risks and get ahead of them before they become a problem.
Yes. Yeah, it's a shifting of that mindset. And I mean, the dentistry field, they just nailed it. You got the check-ins, and you also got the 2 times a day brushing your teeth. Like that's nailed into everyone now. Like, could you imagine?
And flossing, JT.
And floss. Sorry. Yeah, sorry. I'm getting better. I'm getting better. But flossing. But even
Dr.
that,
Erin Spencer is my dentist, and she would be proud of me for saying that.
There you go. I'm getting better. But you know what I mean? Like, think about your body as your mouth, like, movement snacks throughout the day, even if it's not like a full-on workout, like doing something for your body twice a day, and then going to get a checkup from a professional that can help you really fine-tune some things and make sure you're feeling good throughout your training. Is like, God, it's such a what a like gift that is. So I'm very passionate about getting kind of changing the landscape of the rehab world as more of a proactive a treatment that looks a lot like dentistry. And it's exciting to think that because there are a few patients that are starting to get that trend, and that's one of my favorite things to talk about with patients is that. So
I love it. And I think along those lines, there is this there's this growing trend of people who want to really optimize their health and want to optimize their movement. There's just not a lot of opportunity for them to really do that, because I think in our model, both in physical therapy and chiropractic, in orthopedics as well, like in orthopedics, that there's not really this avenue where that is the standard yet. So it's just I think culturally not a thing that we really even recognize yet. But I think as providers, we were talking about this before the show, that is our ideal person to work with, right?
Favorite.
Someone who comes in, they're like, well, what brings you into that? They're like, well, honestly, I feel pretty good. I just kind of want to stay that way. you're like, oh my
Let's
gosh,
go.
this is awesome.
Awesome.
Like, this
Yes.
is so great. Like,
I get
yes.
so pumped, dude.
Dude, we could do so many cool things, like improve so much of your motion, improve your strength, make you just a much, much better athlete all around, you know, and then not have to worry about pain all the time.
Yeah. And know if something does happen, I have this person now that I trust. Like that's,
Yeah.
Obviously this is coming from two people that do this for a living. So obviously we're going to have a little bit of bias, but I've seen great results from people that have done it. And I do like your point on the, kind of where we're at as a field, like insurance would not cover that if you're not injured, that and it's not affecting your ADLs and quality of life, then you're not going to get that covered by insurance, which is a shame, but that's where we're at. That's why I think both of us started our own businesses so we could treat people the way that they want to be treated and do as much therapy as is needed. So hopefully, you know, there's a trend forward, but we know there is a limitation, unfortunately, with where we're at.
Totally. Yeah. I think these all these questions that came in, I think just stack on top of each other so nicely. If you think about balancing training with old injuries and pain management, how do you think about approaching all of that?
Yeah.
The question that came in, what really wasn't a question, it was more of like a statement, but I understand what the question is.
Yeah.
But like, how do you approach, like you have this history of old injuries, or there's somebody who maybe has a lot of old injuries where maybe they're coming to the table and quite frankly, they might not have a full deck of cards, right? They may have had a previous ACL tear. They may have, you know, arthritis somewhere. They may have a history of a bad low back injury, you know, something like that. And they're coming to the table without this full deck of fitness cards, and you're still just trying to help them train and optimize the best that they can. What's your way of approaching that? How do you manage that situation and help them manage both pain and also their training load?
Yeah, it depends on what they're training for. I would want to specify that. Like, are you training for a marathon? Are you just trying to get in the gym a couple times a week and have an active life? Like, really define their goals so I know, okay, what is this person training for? So we know that, and then now we need to go into the history. Okay, what is the old injuries? Where do you feel vulnerable? Because the fact of the matter is, one of the highest risks of injury is a previous injury. So we know that, let's use the ACL, for example. I think that's a great example. If you had an old ACL surgery back when you were 16, you're 35 now. Yeah, there's likely been some changes there over time, and, you know, it could potentially hasten the potentially like arthritic changes in that joint. We know that that area is vulnerable, so let's make sure that we're doing a full assessment of how that's accepting the load of what your training is going to require. So want to do a full assessment of, you know, just whatever assessment you like to do, seeing where the capacity is currently, and then start to have a plan that has corrective exercises for that area that is really fine-tuned. Okay, these are old injuries. This is, you know, where you've had pain. Like, let's have a plan here. And then, you know, having a plan for, okay, this is what you're training for. This is how we can modify your training load for right now for what your capacity is. And then as these two build together, then we can start to increase the training a little bit as your body tolerates. So, because I know part of the question was about pain management. Pain is a beautiful thing. It will tell you when you're doing too much, and we need to listen to that. So knowing kind of the skill of listening to your body is another important conversation in that. So yeah, it's all going to be individual to the patient. Again, goals, history, you know, what they can take on. So yeah, that's kind of where I'm at with that.
Yeah, I like that. That individualized, like really making sure that it's individualized to what their own goals are. I think that's really good.
Yeah.
I think tangibly, a few things come to mind for me is, number one, I want to be aware of what their pain pattern is. And it's like, okay, is this something that's continually flaring up every single time that you're exercising? Or is this just something that flares up every once in a while when you do a little bit too much? You know, it's like, you know, if you're going and you have a history of knee issues, and then every single time you go run, your knee just like absolutely throbs and kills you for a day and a half afterward, That's different than, oh, I went on a run, I ran a little bit harder, or, did a little bit more than I was used to doing, and my knee was sore for a day. And then now and this has also happened to me in the past, right? Does that make sense? Does that difference make sense? So it's more of like, is this something that's continually coming up day after day after day, and you're just saying screw it and pushing through it because it's an old injury? Or is it just something that you might have a history of kind of dealing with, and sometimes you do a little bit too much, your recovery status isn't as good as it should be, and then all of a sudden things get a little bit achy on you, right? Like, this is a good example, right? Like, we've talked before about my low back injury and how I had a disc herniation in my low back about 2 years ago. And for the most part, like 95% of days, I feel really good and I don't think about my back very much. Because I did a lot of rehab to get to that point, right? But there are certain times where it does start to flare up on me. And this actually happened this past week. So lots of stuff going on at work, lots of craziness, and just like mind constantly spinning all the time. And I remember Wednesday morning, I woke up at 4:30 in the morning, couldn't go back to sleep. Thursday morning, I woke up at 3:30 in the morning, couldn't go back to sleep. Friday morning, woke up at 2:30, couldn't go back to sleep. Saturday morning, same thing. No, dude, just like the wake up and like the mind spinning, like all the things you have to do.
Oh,
like
it's
that stuff. It's like waking up in the middle of the night and it's like, oh my gosh, like I got so many things to think about, and then you can't settle yourself back down.
Yeah.
So that happened like 4 days in a row. And I woke up Saturday morning and I felt like absolute trash. And then I went and I did a workout Saturday morning, and I finished that workout, which should not have been something that bothers my low back at all. And then my low back was killing me. And when I think back on it, I'm like, what could I possibly have done during that workout that would like make it irritated? And dude, there wasn't anything. Like, I swear, like I know my body well enough now, there is nothing that was in that workout that should have caused my low back to be irritated. It was purely a result of the fact that my recovery was absolute just doo-doo, right? And so my low back got sensitive and irritated from that, right?
Yeah.
But I was able to get a couple nights of good sleep, and I woke up this morning and my low back felt good. Right? Yeah. And so it's kind of the same thing. It's like, I'm not worried about that old injury and the pain that I had with that old injury, because I could recognize that there were certain things that were leading it to be the case, right? And if we can pinpoint to those things and now make actions to get over them, we're going to be in a good spot. If it's something that's like, no matter what you're doing, this is still happening, I think that's a different story. And that, to me, is when we start saying like, all right, man, you might not be working here with a full deck of cards. So we have to make sure that everything else around this old injury site is fully optimized.
100%.
Right?
Yeah.
So it's like, all right, if you've got that old knee issue, right, ACL, like reconstruction, and now it bothers you, this, that, and the other, well, it's like, dude, your quad, your glute, your calf strength has to be so on point, right?
Yes.
Your hip mobility, ankle mobility has to be the best it possibly can be, because we need all the other players of the team to do the job that knee probably doesn't have the full capacity to do. And the great news about that, JT, is there is so much redundancy built up in the body that we actually have, like, it is okay if you're coming in and you don't have a full deck of cards, because most of the time when you and I do our job, we actually help the rest of the players, rise to the occasion.
Yeah.
And now you can just approach your training and feel a lot better. But sometimes it takes requiring and recognizing, what those certain key areas need to be in order for you to get that result.
Yeah. Oh, that's great, man. That's awesome. I like that idea too. It's like if on a football team, the star quarterback goes down, you got to throw in backup. Let's make sure the offensive line is the best offensive line ever. The wide receivers are, they're doing the whatever drill to make them better. We're doing everything else around the team to make up for the loss of Patrick Mahomes. Now we got, who's out there? Trent Dilfer. He's still playing. No, he's retired. I don't know who the Chiefs backup quarterback is. I like that analogy though, man. That's good. Yeah, I really like that.
Yeah. Yeah, exactly. Like, when the star's out, then the backup's got to rise to the equation.
Yeah, we got to get that glute med going, man.
That's right,
that's
dude.
The backup.
Backup glute med.
Yeah.
I love it. Yeah. Okay, we had a few more that came through, but I don't think we quite have time for that. So we're going to table those maybe till season 2.
Season 2.
Yeah, buddy.
Did we already get approved for that?
Do we have anybody that we need to get approved?
I don't know. Do you have to? Is that an approval thing?
I think we're just kind of making this up as we go.
It's our decision.
Yeah, I think we
Okay,
decide.
cool. I got you.
Yeah.
I didn't know if there was like a regulation board that did that. Or
Yeah,
whatnot.
not that I'm aware of, but
Okay.
I mean, it could be. Yeah, I could get a pink slip in the mail.
Yeah, you
later.
guys don't. No, you're done.
Yeah, it's like, hey, you got
Y'all are
banned.
weird, man.
Yeah.
I gotcha. No, hopefully there is.
Yeah, we'll save that. We'll save those for season 2 because we had a lot of other good ones that I think we just don't have time to get to. But wrapping up season 1, what's been your highlight?
Oh man, easy. It was one of the hardest I've laughed so far. We were talking about the cup theory of so the cup theory, to brief explanation if you didn't see the episode, is essentially like when everyone has a cup and you can only fill it up to a certain amount. Like a lot of things go into it, like you're stressed from work, stress from a job, stress from like a relationship. And then if your stress builds up to a point where you only have this much available left, like that's how much physical capacity you have left. That's the brief explanation. And you said, like one thing that we try to do with patients is we try to augment their cups or like cup augmentation. And because I like right when you said it, you looked at me and I was like biting. I was biting my tongue as hard as I could, and you luckily you laughed first, so and then once I got the clear from you to laugh, I started busting out laughing. And that was still one of the hardest I've laughed because it just happened. So we didn't plan that; just happened naturally. Now I will always remember that. That was my favorite moment of the episode. Okay, but certainly the favorite. I mean, just part of this. Honestly, like having conversations with other rehab professionals is so fun for me. Like I learned so much from you the last 6 episodes. Just hearing your experiences, learning about what you've gone through with your specific injury, especially your low back injury. I really respect your kind of your drive to get back to where you are there. And then just hearing your approach with patients. I think it's you always learn so much from hearing someone else talk, man. And I hope that you don't have to start a podcast to have conversations with other professionals. And I really encourage you to have, if you're a physical therapist or you're a chiropractor, have a conversation with someone that's not in your field. Yeah. Maybe that like there's biases against, or that there's, even competition, like athletic trainers are another profession that I would love to have more conversations with. They have so much to teach us. And unfortunately there's some divide there that I've experienced in the past. So, it's just encouraged me to talk with more rehab professionals and medical people and just learn from them and start to take away the competition and just remember that we're all just trying to help people. And that's kind of one of the focuses of the podcast that I hope people got. So that was just cool. Really glad we did it, man. Yeah.
Me too, man. Me too. Yeah. Try to help people and have some fun along the way as well.
Man. That's it. What about you, man?
Yeah, man, I think like my highlight was your really good breakdown of pain science and the biopsychosocial model. And it's always good to hear that and learn that again, just more information and also just like lots of new ways to just incorporate that and think about that in practice too. I think is really awesome. Just always good reminders that, pain is always multifactorial, right? There's always lots of things going on. So, man, I loved this. This was great.
Yeah, this was awesome.
Awesome. Great job this season.
Yeah, man.
Okay?
You too, dude.
Thanks.
You were driving the boat, man. I was just along for the ride, man.
Hey, we're all in it together, one day at a time.
Yeah, man.
So awesome, dude. All right. Well, we'll talk to you later. Everybody else, thanks so much for tuning in this season. Go out there and just keep being the healthiest version of yourselves and stay tuned for season 2.